Before initiating a manual defibrillation, you should first verify that the patient is in cardiopulmonary arrest. Care providers may see that their patient is unconscious, pulseless, and not breathing normally. If the therapy cable is not already connected, connect it at the top of the device. You can now power the device on. If the defibrillator powers on in AED mode, press Manual Defib in the lower right corner of the touchscreen. If the defibrillator powers on the home screen, press Therapy in the lower right corner of the touchscreen. Connect the therapy electrode pads to the therapy cable. You should prepare the patient's skin for therapy electrode pad placement. Apply the therapy electrode pads to the patient's chest in the anterior lateral or anterior posterior position. Confirm the desired energy is selected. You can select the desired energy using the up-down arrows, directly on screen, or by utilizing the speed dial. Once the desired energy is selected, push the Charge button on the keypad. While the defibrillator is charging, yellow shading appears in the energy dial and a ramping tone sounds, indicating the charging energy level. When the defibrillator is fully charged, the screen will display available energy and the push shock prompt. The shock button will also flash. Before pushing the shock button, confirm all personnel, including the operator, stand clear of the patient, stretcher, bed, and any equipment directly connected to the patient. You can also confirm the ECG rhythm requires defibrillation as well as confirm available energy. Once everyone is cleared from the patient, you can push the shock button to deliver energy to the patient. When the shock is delivered, the energy delivered message will appear. The shock counter in the top left corner of the therapy screen will show the number of shocks provided to the patient. Depending on the device configuration, some devices may be set up to automatically escalate energy after a shock is delivered. You can always check their next available energy at the top of the screen. The CPR timer ensures that CPR is performed for the length of time specified in your protocols. The CPR metronome provides audible prompts that guide providers to deliver CPR at a predetermined rate. The metronome also provides audible ventilation prompts to cue the rescuer when to provide ventilations. Selecting the gear icon will allow you to select additional compression-ventilation ratios. Compression rates and prompts may vary, so always check your local protocols prior to use. To start the CPR timer, press Start. The timer circle and time display indicate the remaining CPR time. Should you need to stop the CPR timer, press the timer circle. Once the CPR timer is stopped, it automatically resets to the default CPR time the next time CPR is started. To mute and unmute the CPR metronome and ventilation prompts, press the speaker icon. It should be noted that muting these prompts will not silence alarms. Your LIFEPAK 35 may be configured with CPR Insight available in manual mode. When CPR Insight is enabled and a shockable rhythm is detected during CPR, CPR Insight enables the LIFEPAK 35 to accurately analyze the patient's heart rhythm during ongoing chest compressions. CPR Insight analysis technology enables the defibrillator to analyze the patient's heart rhythm while CPR is being performed. This can reduce pauses in chest compressions, thereby reducing interruptions in circulation of the blood. CPR Insight will only be active when the CPR timer is turned on with therapy electrode pads applied. If the CPR timer is turned off, the therapy electrode pads are disconnected, or the charge button is pushed, CPR Insight analysis will not run. You can mute the CPR metronome without affecting the CPR Insight analysis. In manual mode, CPR Insight is turned on by pressing the CPR Insight button. When active, at the end of the CPR time, CPR Insight analysis will reach one of 3 treatment decisions: shock advised, no shock advised, or check rhythm ECG analysis inconclusive. All three of these decisions will have their corresponding messages appear directly on screen. If the CPR Insight decision is shock advised, a shock advised message will appear. Additionally, some LIFEPAK 35 devices may be configured to pre-charge in manual mode. If this setting is turned on, the device will begin charging near the end of the CPR time so that the device is ready to deliver a shock as soon as the CPR cycle ends. Charging indicators appear on the screen while the device is charging, and some devices may be configured to also include a charge tone. After a shock is delivered, the CPR timer automatically starts a new CPR cycle at the end of the CPR time. If the device is not set up with the pre-charge, you will see the shock advised message appears, but the device will not automatically charge. If the charge button is not pushed, the CPR timer will automatically start a new CPR cycle. If the CPR Insight decision is that no shock is advised, a no shock advised message will appear, and the CPR timer will automatically start a new CPR cycle at the end of the CPR time. If the CPR Insight decision is inconclusive, a check rhythm ECG analysis inconclusive message will appear, and the CPR timer will automatically start a new CPR cycle at the end of the CPR time. You should then assess the patient rhythm. Thank you for watching the LIFEPAK 35 manual mode video.